She's taken the test again, and it's still negative. Month after month, year after year. The heartbreak is real, and the questions are endless. Why is this happening to me? Am I broken? Will I ever become a mother? If you or someone you love is struggling to conceive, this video is for you. Today, we'll break down female infertility, what it means, why it happens, how it's diagnosed, and most importantly, what you can do about it. Because infertility doesn't mean the end of the journey. Sometimes, it's just the beginning of a different path to parenthood. Make sure to hit that subscribe button and tap the notification bell so you never miss content that empowers you to take charge of your reproductive health. What is female infertility? Let's start with the basics. Infertility is medically defined as the inability to get pregnant after 12 months of regular, unprotected sex, or after 6 months if the woman is over age 35. It doesn't mean a woman can't ever get pregnant, but it does suggest that something may be affecting her ability to conceive naturally. Globally, over 186 million individuals and couples suffer from infertility, and roughly 1/3 of the time, it's due to female factors. This is not rare. This is not shameful. This is a reality millions of women face every day. Signs and symptoms of female infertility. So how do you know if infertility might be an issue? Here are some signs to look out for. Irregular or absent periods. This may signal problems with ovulation. Very heavy or very light menstrual flow. Pain during sex or menstruation, possibly indicating endometriosis or fibroids. Hormonal symptoms like acne, excessive hair growth, or unexplained weight gain, which could be tied to polycystic ovary syndrome, PCOS. No pregnancy after 6 to 12 months of trying. But here's the tricky part. Many women with infertility don't have any obvious symptoms. That's why getting evaluated by a doctor is so important if conception isn't happening as expected. Causes of female infertility. Female infertility has many possible causes, and sometimes it's a combination of factors. Let's break them down into major categories. 1. Ovulation disorders. Ovulation must occur for pregnancy to happen. Issues like polycystic ovary syndrome, PCOS, the most common cause. It leads to irregular ovulation due to hormone imbalance. Hypothalamic dysfunction. Stress, extreme weight loss, or excessive exercise can disrupt signals from the brain to the ovaries. Premature ovarian insufficiency, when ovaries stop functioning normally before age 40. Hyperprolactinemia. High levels of prolactin can interfere with ovulation. 2. Fallopian tube damage or blockage. Sperm and egg meet in the fallopian tubes. If they're blocked or scarred, fertilization can occur. Causes include O. pelvic inflammatory disease, PID, O. endometriosis, O. previous surgeries, O. ectopic pregnancy. 3. Uterine or cervical problems. The uterus must support implantation and fetal growth. Fibroids, non-cancerous tumors that interfere with implantation. Polyps or adhesions, scarring from infections or surgeries. Cervical mucus issues, prevent sperm from reaching the egg. 4. Endometriosis. This is when the uterine lining grows outside the uterus, often causing inflammation and scar tissue, which can impair egg release, fertilization, and implantation. 5. Age-related factors. As a woman ages, both the quantity and quality of her eggs decline, especially after age 35. This increases the risk of infertility and miscarriage. 6. Lifestyle factors. Smoking, excessive alcohol, obesity or being underweight, high stress, poor diet. All these can interfere with hormonal balance and ovulation. 7. Unexplained infertility. In about 10 to 20% of cases, no clear cause is found, even after testing. It's frustrating, but treatment is still possible. How female infertility is diagnosed. If you suspect infertility, what's next? A fertility evaluation typically includes 1. Medical history review. Your doctor will ask about your periods, sexual activity, previous pregnancies, health history, and lifestyle. 2. Physical exam. This may include a pelvic exam to check for abnormalities in the reproductive organs. 3. Ovulation testing. Blood tests to check hormones like FSH, LH, estradiol, and progesterone. At-home ovulation predictor kits, OPKs. 4. Ultrasound. A transvaginal ultrasound can evaluate the uterus, ovaries, and follicles. 5. Hysterosalpingography, HSG. An X-ray with dye is used to check if the fallopian tubes are open and the uterus is normal. 6. Laparoscopy. A minimally invasive surgery to look directly at the ovaries, uterus, and fallopian tubes, especially useful for diagnosing endometriosis or scar tissue. 7. Other tests. Depending on symptoms, doctors may test for thyroid problems, prolactin levels, or conduct genetic testing. Treatment options for female infertility. Now the big question, can female infertility be treated? In many cases, yes. Here are the main options. 1. Medications to induce ovulation. These are often the first step. Clomiphene citrate, Clomid, stimulates ovulation in women with PCOS or irregular cycles. Letrozole femora, especially useful for women with PCOS. Gonadotropins, injectable hormones that directly stimulate the ovaries. These medications increase the chance of releasing one or more eggs each cycle. 2. Intrauterine insemination, IUI. Sperm is washed and inserted directly into the uterus at the time of ovulation. It's often combined with fertility medications. 3. In vitro fertilization, IVF. A more advanced technique where eggs are retrieved, fertilized with sperm in a lab, and the best embryo is transferred to the uterus. It's effective for blocked tubes, severe endometriosis, advanced age, unexplained infertility, failed IUI attempts. 4. Surgery. To remove fibroids, polyps, or scar tissue. To treat endometriosis. To repair blocked fallopian tubes. 5. Donor eggs or embryos. For women with poor egg quality, donor eggs from another woman can be used with IVF. 6. Gestational surrogacy. When the uterus is not functional or safe for pregnancy, another woman, the surrogate, carries the baby using the couple's embryo. Natural approaches and lifestyle changes. While medical treatments are powerful, your lifestyle also matters. Here are evidence-based tips. Maintain a healthy weight. Exercise regularly, but not excessively. Quit smoking. Reduce alcohol and caffeine. Eat a balanced diet rich in folate, omega-3s, and antioxidants. Take a prenatal vitamin. Track your cycles with fertility apps. Manage stress through therapy, yoga, or meditation. Some women also explore acupuncture or herbal medicine, though scientific evidence is mixed. Always consult your doctor before adding alternative treatments. Emotional impact of infertility. Infertility is not just a physical condition. It's deeply emotional. Women may experience depression, anxiety, guilt, grief, marital strain, isolation. But you are not alone. There are support groups, fertility counselors, online communities. It's okay to cry. It's okay to ask for help. Your mental health matters just as much as your physical journey. When should you seek help? After 12 months of trying under age 35. After 6 months if you're over 35. Immediately if you have known issues, PCOS, irregular cycles, past infections, or surgeries. Reproductive endocrinologists are experts who can guide you through diagnosis and treatment. Don't wait in silence. The sooner you get answers, the sooner you can take action. Infertility is hard, but it is not hopeless. Thanks to medical advances, many women who once believed they'd never have children have gone on to become mothers. Through fertility treatment, surrogacy, adoption, or other paths. Every woman's journey is unique, and every journey deserves support, compassion, and respect. If this video helped you understand more about female infertility, please give a thumbs up and share it with someone who needs to see this. Have questions or want to share your story? Drop a comment below. We read every one. And don't forget, hit that subscribe button and turn on notifications so you don't miss future videos about fertility, reproductive health, and wellness. That you're not alone on this path. And wherever you are on your journey, we're here to walk with you.